Okay, I'd like to introduce Ms. Jenna Brown, who will be moderating today's panel on community resources. Ms. Jenna Brown began her career as a middle school teacher at a local Title I school for 8 years. During her time as an educator, Jenna and her husband conceived their now 5-year-old daughter, Harper. While pregnant, their unborn daughter was diagnosed with MMC spina bifida. It was at this time Jenna felt her path start to alter. Jenna remained a middle school teacher for a year and a half after Harper's birth before becoming a full-time volunteer, advocate, and spokeswoman for pediatric neuroscience and children's health in general. Jenna and her family represented MUSC as the campaign family for the Pediatric Neuroscience Research Fund under Dr. Eskandari, which ultimately led to her current position as the Director of Development at Camp Rise Above.
Hi, everybody. Thank you, Dr. Sangiovanni. I would also like to thank the Spina Bifida Association of the Carolinas and MUSC for hosting this entire education day today. I'm going to introduce you to some amazing panelists that we have as community resources. Each panelist is going to give you their own story. I'm going to introduce them. I think it's very important for us as families and parents and people living with spina bifida that we gain a sense of trust in who we go to and we seek help from and advice from. So you're going to get to hear each of their story. Just a couple housekeeping things. I know that this is a panel, and usually when we're doing live panels, you guys are able to interact with each of these people in person and ask questions as we go along. We're still going to continue to do that. So as we're going along, the only thing that I ask is that once you have a question for these panelists, that you address them directly. If you have a question for one of them specifically, because there are 7 of them. So as you ask me a question, I need to know who you're addressing. If I miss any of your questions while the panelists are speaking, we will have an allotted time at the end for several minutes where we'll go through the questions, and I will ask a few of my own. Feel free to hold those questions to the end or type them as we go. So our first panelist is Ashley Thomas. Ashley is mother to 3 grown children. For decades, she's been on the front lines as an advocate, public speaker, and adapted sport event designer. Ashley and I turned a 30-minute conversation into over an hour-long conversation. So believe me when I say she's the one you want fighting for you when the battle lines are drawn. She is an adult living with spina bifida and tethered cord. She believes that yes, I can is possible with adaptations. With this mentality, Ashley founded Bridge to Sports 15 years ago and still serves as the CEO today. Welcome, Ashley.
Hey, thank you for having me.
Yeah, Ashley, so if you want to tell us a little bit about your mission and what you do at Bridge to Sports, we'd love to hear it.
Sure. I thought it was a very interesting segue, listening to the detethering Chiari, I think tick, tick, tick. And just for all the families that are listening, I am 58, going almost 60. And I didn't know if I could watch that video because I had surgeries in the dark ages where a lot of these things weren't even considered. But it's amazing to see how technology has changed and how much the knowledge and understanding of spina bifida and all the different fingers and tangents that go along with it. And so I really enjoyed that. So great job, folks. But I do want to share a little bit. Bridge to Sports is an organization that creates adaptive sports for people with physical disabilities. So in our program, we actually have folks who are blind. We have people who have cerebral palsy, spina bifida, spinal cord injury, amputees. And part of it is, we're celebrating the 30th year of ADA. And I have to say, when I look back, I sometimes go, what did we do? Because we still aren't where we need to be. But it's easy to get ourselves in our own space. And I definitely believe there's a need for support groups for each of our disability types, because that's where you really learn the tips and tricks. It's from other people who live it every day. But with adaptive sports, we blend. We have a lot of different types depending on the functionality. And we learn that other people are just as capable, even though they may speak with the accent of CP, or they may sign. And so I think it's really important for all of us to look beyond what we know and learn about other disabilities, because we will be stronger advocates. So off the platform now. But
it's hard to come off of that. I know it's very hard to step away from it.
But we run 12 adaptive sports. And I can say today, even with COVID, we have air rifle going on as well as archery going on. We set up big tents so that we can honor 6 feet apart, masks. So we've really worked hard to figure out how to keep people with disabilities active, because I think as you know, when you're young, you have mobility limits. You cannot see me, but I'm a wheelchair user. I think it is one of the crucial things to have a healthy life as you get older. And I have had 3 children, natural births. And, you know, if you have children, they're active, Lord knows they are. And I think I want to encourage everyone to think how you might become active. There's all sorts of videos out there right now. I know we're all kind of fatigued with this stuff, but I would say it is so valuable to have your mobility as long as possible to stay active. And
Ashley, just as a question at Bridge to Sports, what age are you serving?
So we love them coming in as early as 5. That's our youngest, and then we go up to 99. So yes, and I would say in our program, 95% of our kids go on to college or technical school. And those are people who may use wheelchairs. Some of them are ambulatory with crutches. But there's something about a cognitive development when you're putting physical activity in it. And for any parent out there who's going, well, that's easy. My child does this, this, and this. What I want to encourage you with is we do know what we do, and we have a ton of adaptions. That's why my worldview is you can't.
Ashley, can you mention some of those? I think we talked about some of those equipments and stuff. Can you mention some of those that you have?
Absolutely. So I talked about archery and air rifle. We have a frame that actually, if you don't have dexterity in your hands, your upper arms are weak, or you're missing fingers and arms or hands, we have adaptions that'll actually hold the arrow, and you can release the arrow or shoot the air rifle with a mouthpiece. All you have to do is go, and that's it. If you want to kayak, similarly, we have adaptions on the outriggers. And if someone's missing an arm, there are adaptions on the arm, because this is the movement you need. So wheelchair basketball, the sports chairs are very different than the day chairs. They have cambered wheels that allow for ease. It's actually easier on your shoulders and easier to move those chairs. Our warehouse has probably, I don't know, 1 million and a bit more of adapted equipment. So I always like to challenge people, or hand cycling. I can't tell you how many different types of bikes, trikes, because someone who's had a stroke may need something a little different than someone who's a high spinal cord injured.
Right, yeah.
So encourage everyone, don't be willing to look. And I think from a parent, you don't want your child disappointed anymore, because you live with lots of disappointments. And I would say don't be afraid to look, because it has such a profound long-term impact on the life of that child.
So I have a question coming in for you, and then I'm going to have you address this question, and then we're going to meet our next panelist.
Thank you.
So does your organization, and as a community resource or a national resource after getting to talk to you actually, Ashley wants to know if your organization has programs outside of the United States, but I know that you are a wealth of knowledge. So if you do not, what do you know that's out there for them?
So I would go to the International Olympic Committee, because yes, there are programs all across the world that are similar to what mine is. And so it is going to take a little digging around. If you're out of the country, Challenge Athlete Foundation actually funds worldwide. And I would say they're our best resource in the US to find connections into other countries. So I would go to Challenge Athlete Foundation.
Perfect. Thank you, Ashley. For everyone that's attending right now, I am being told that there is also a raise your hand capability at the bottom, and that we are going to be taking live questions as well right now. So you don't have to type them in. You can interact with us live right now if you choose to do it that way. Ashley will be back up at the end when all the panelists are together in case you have more questions for her. Next, we have Thomasina Kelly. Thomasina started in accounting while carrying a heart and compassion to help others. With the desire, she left her career in pursuit of happiness to become a counselor and assist individuals as they process traumatic experiences and issues that arise within families. In less than half an hour on the phone with her, I could take a deep breath after talking to her about life in quarantine. So she comes very highly recommended by me. Thomasina is working towards her license in therapy and specializes in addiction. She is currently a counselor with South Carolina Vocational Rehabilitation. Welcome, Thomasina.
Hello. Hello. I apologize. Look like my camera has some challenges here going on, so I do apologize. But thank you so much for having me here. I am with Vocational Rehabilitation, so I just want to tell you a little bit about the services that we offer. Our mission is to assist individuals that have been diagnosed with a disability to help them gain and maintain sustainable employment within the state of South Carolina. We are partnered with the WIOA, which is the Workforce Innovation and Opportunity Act, and we're able to combine our strengths with them to help those individuals overcome various barriers to their employment. So we help individuals who may have been diagnosed with a mental disability, physical disabilities, psychiatric disorders. We serve over, there's like I'll say maybe over 130 different disabilities that vocational rehabilitation are able to assist individuals within the state of South Carolina. We do that through a delivery process, which includes assessments, disability management. We have trainings. We do job search, job placement, job retention services. We have a business development specialist who also acts as a liaison between the employers within the communities. And so what she does is she tries to find like what services or what needs they have to try and pair them with our consumers. We have rehabilitation technology assistance. We have comprehensive evaluation services. We also have services that we provide to help individuals that may have substance use disorders. That is actually kind of takes place in Columbia, though. They have to go for a minimum of 4 weeks, and they get the mental, physical, as well as the substance abuse is addressed. So all of that is kind of through a more clinical aspect or approach. As far as the age in which we service, we have transitional counselors who actually are in the schools. So we start out with age 13 through adulthood. And so what those counselors do is they kind of track and they follow the students throughout their educational history. And then if we also have partnerships with colleges, technical schools, because of course they have a disabilities department there, but we partner our services with them to also better assist those individuals so that they can achieve their academic pursuits and reach that career in which they're pursuing.
So Thomasina, one question I have is, I know I work with children, and one thing that we are trying to expand on is that transitional phase from becoming a teenager to a self-advocate. Those counselors that you're talking about right now that offer those programs to teenagers, do they continue to counsel them as they come into an adulthood to self-advocate?
So what happens is once they graduate high school, they transition from a transitional caseload to a general caseload. So then that's more on the adult side. So that helps them, like you said, with preparing them for job search. We do job training, application assistance. We teach them soft skills. We have a work training center within the facilities where they learn various soft skills to kind of help them be more marketable. And, you know, we help them with maybe like building their self-esteem, confidence, you know, by simulating a work environment for those individuals as they are, you know, just starting their process and getting into the workforce.
Right. Well, thank you. And if anybody has questions for Thomasina, again, please address her and she will be back up at the end to answer any questions that you may have thought of in the meantime. Thank you. And thank you for helping me take some deep breaths and getting towards life in quarantine.
You are most appreciative. Thank you.
Our next panelist is Tracie Hayward. At Camp Rise Above, which is where I'm the Director of Development, we supply customized camping experiences to children with serious illnesses, disabilities, and life challenges. And I have had the distinct pleasure of spending time with 2 of her 3 children, James and Landon, through our summer programs at Camp Rise Above. We have very similar backgrounds, going from being moms on a mission to now a career which identifies with our passions. Tracie began as a dedicated volunteer and has now been with Family Connection of South Carolina for 10 years. She currently serves as the Family Engagement Manager. Welcome, Tracie.
Thanks, Jenna. So I just want to tell you guys a little bit about Family Connection of South Carolina and what we do. We are a statewide nonprofit and we have locations all throughout the state of South Carolina. We're celebrating our 30th anniversary this year, so we were started 30 years ago. And we are pretty much a parent support network. So our mission was founded on helping parents connect with other parents who know exactly what it is to go through having a child with some type of disability or special healthcare need. Now, what does that mean, a disability or special healthcare need? Really, at our organization, we serve anyone who might have any type of condition that they would see a specialist for. If it would be anything from a physical disability, developmental delay, intellectual disability, anything. And even if you have a child without a disability, if you call us and you need help, we will help you. We'll never turn anyone away, and all of our services are free. So we serve parents with children with all diagnoses all across the state of South Carolina. And one of our main programs that we do is our support parent program. So if you call, you say, oh, I have a child with spina bifida, I'd really like to talk to another parent who has a child with spina bifida. We have over 700 trained support parents all across the state of South Carolina with all different diagnoses who are willing to talk with other parents by phone and kind of provide that emotional support and connection that we are all hoping to have. Some of the other things that we do at Family Connection are help connect families with different resources in their community, be it social opportunities. You know, in the pre-COVID era, we had a lot of different support groups and activities. Like play dates and sensory-friendly movies and different events around town at different venues that we had helped organize.
So,
we can also
Tracie, can I backtrack for 1 second? So
yeah.
You talked about you know, the parent the groups and the emotional support groups, and my work as being an advocate, I know that sometimes I will get a referral from somebody who has a child who's diagnosed with somebody and a lot of the times those families are fearful of reaching out. They want to keep to themselves. They feel like this is something that only they can identify with, and the emotional struggle to really talk to somebody else. And sometimes you just don't want to feel like a burden in someone else's life because you know that they may have things going on. What would you say to those families, and what outcomes have you seen once those parents have been able to pair together?
So, I mean, absolutely, that you're pretty much describing me. When my child was first diagnosed, when I called, you know, it took me about 6 months of complete isolation before I realized I need to like do some research on this and find out some more information. And I pulled out like a big stack of brochures that I had been given and just started calling people. And even when I called Family Connection and they gave me resources and they said, do you want to talk to another parent? I was like, oh, absolutely not. I do not want to do that. Like, no way. And, I'm not ready for that. And so even sometimes we just encourage parents to call and reach out, and they can talk with one of our family engagement managers on the phone, and, we can just give them some resources. And sometimes that turns into, a connection where you can start talking about things. And even if you're not ready to talk one-on-one with a parent at that point in time, we're always here. And I called back about 6 months later and said, okay, I have so many questions now that I would like to get someone else's input on. And even with our groups, if people can just come and hang out and there's no pressure to talk or do anything like that, and just hear what other parents might have to offer or their experiences.
Sometimes it's just being an ear and a shoulder.
Exactly.
Yeah, if you'll keep going. Sorry to interrupt you, but things pop
No,
up.
you're good. You're good. So events and activities, things like that. So some of the other things we can help with, there's 2 more things that are kind of important I want to make sure I hit on, that you guys know that we're here and available to help with, is navigation of Medicaid and TEFRA Medicaid. So TEFRA Medicaid is in the state of South Carolina. If you're not eligible for Medicaid based on a parent's income and resources, your child might be eligible for Medicaid if they have a disability and they meet certain criteria. So if you're interested in applying for TEFRA Medicaid, or you need help with the application, please call us at Family Connection and we can help walk you through all of your options for that. And the last thing I want to talk about is that in 2015, Family Connection was awarded a federal grant as the Parent Training and Information Center for South Carolina. And so what that means is it's our responsibility to help parents understand what their rights and responsibilities are when it comes to special education in South Carolina. So if you have any questions about your child's special education, if you need help understanding your child's IEP or 504 plan, or you're not sure what they might be entitled to, or you just have questions about special ed in general, please give us a call and we, again, will help walk you through everything you need to know.
Tracie, we have a similar question that came in earlier, but directed towards you. McKenna wants to know, are your services only available to South Carolina residents? She and her family will be moving from California to North Carolina coming soon. And she wants to see if there's anything available to her family.
Sure. So every state has a federally mandated parent training and information center. So North Carolina has one too. And we also receive federal funding as what they call a family-to-family health information center, and every state has one of those as well. So if you're not able to locate those in North Carolina, feel free to reach out to me by email or phone, and I can pass along the information for the Parent Training and Information Center or the Family-to-Family Health Information Center in North Carolina.
Perfect. Thank you, Tracie. Tracie, again, will be back up at the end if you have any questions for her. Our next panelist is Mary Saunders. Mary actually helped my family qualify for TEFRA. She made the process run so smoothly. She immediately answered all of my questions, and she even submitted our application for us. Mary started inpatient, but she found she wasn't getting the interaction that she wanted. Mary needed to be hands-on with families and wanted to make those personal connections, and that she has. After 10 years in outpatient as a healthcare representative with Change Healthcare, Mary has made lifelong and ongoing relationships that Mary told me, even make her coworkers in the office jealous because sometimes she receives a chocolate delivery. Welcome, Mary.
Thank you. Thank you for having me. Yes, I have been here working at MUSC for almost 10 years. Before that, I used to work for Medicaid. And when I started here, it was only inpatient. And after almost 2 years doing inpatient, this position opened, which is helping with all the outpatient clinics, Rutledge Tower, interventional radiology, Storma Institute, all pediatric clinics. And I got it, and it's been great helping the clinics And we work together with the social workers and case management and doctors to get self-pay patients or patients that have insurance, but their insurance doesn't cover everything. And then we help them with getting Medicaid, either PHC or TEFRA, which is for severely disabled children. We also help with Social Security disability for adults and SSI for adults and children.
Mary, TEFRA is something that is here in South Carolina that I would love for you to expand on even more. But is TEFRA or something similar offered to those who are watching within other states?
I believe so. It's called Katie Beckett here too, or TEFRA Katie Beckett, but this is a program for families that are over income for regular Medicaid for children, and then they look into the children's resources and income. Sometimes children receive Social Security from a parent, so that income is counted against them, or they have a savings account the parents open even before, or when the baby was born and for college or whatever, they open a savings account and the child's name is on that account. That is counted. Life insurance policies, as well, if they have cash value and all that, and it's in the name of the child. But I believe so. I don't know. Medicaid is different in every state. So it's really hard for me to know, I will have to look into each state to see. But SSI, it's federal, it's everywhere. So parents that qualify, that have low income, and sometimes they think it's very, very low income, and it's not, because they take into consideration how many parents, if both parents are in the household, if it's just one parent, if there are other siblings that don't qualify for anything. So they count all that, and at the end, the income is more than what people think. And then, but we look into all that. And SSI comes with Medicaid as well, so it's also very good to have. You get a check for the child, and then you also get health insurance.
But TEFRA is aimed specifically towards families of children with disabilities, correct?
Yes, it's actually on the Medicaid policy. It's for severely disabled children, and it's why once we complete all the application, we send it to DHHS, and then they will get in touch with the parents to send a nurse to evaluate the child, and then evaluating at the same time the other portion of, let's see if the kid doesn't have any resources and all that, financially clearing everything, and then clearing the disability, and then once everything is approved, then the child is approved. And it's up to the age of 19.
And then there's an evaluation process throughout, correct? If the child qualifies, there's an evaluation process that's continued. It's not.
Yeah, they review the cases every so often. I cannot tell you how often they do it, because sometimes they don't touch it until the child is 19, and then they close it. So it's really, some they do, some they don't, but yeah, they do. They review the cases to see if the child is still disabled. Mm-hmm.
Mary, I have a question for you, coming in for you. I hope I'm saying the name right, from Ramu. I think you kind of touched, it's called the Katie Beckett waiver in Georgia too. He wants you to know. And he wants to know if you know anything more about ABLE accounts. He says he believes that it's a federal or national level thing. ABLE accounts.
Never heard of it, sorry. Never heard of it.
Maybe it's just something in South Carolina that we don't have.
Maybe.
Well, thank you, Mary. I'm gonna have you stick on and then do a Q&A at the end. So if anybody has any questions for Mary, thank you. See you in a few minutes. Our next panelist is Shelli Quenga. Shelli and her partner have successfully co-parented 5 children into adulthood, all of whom have some special type of healthcare need, ranging from ADHD to autism, dysautonomia, and cerebral palsy. They are now able to somewhat sit back and enjoy their 3- and 5-year-old grandchildren. Shelli's career was driven by her caregiving experience and passion for connecting families to resources that make a difference in their lives. She is now the Director of Programs at Palmetto Project. Welcome, Shelli.
Thank you. So Palmetto Project is a statewide nonprofit organization in South Carolina. So we serve families in South Carolina in a variety of ways. We are the statewide affiliate for Dolly Parton's Imagination Library, which provides free books to children under the age of 5 every month until they turn 5. And we also provide the I voted stickers to the Election Commission. So that's how you've probably seen us, but didn't see the Twitter handle or our name underneath it. So we've been doing this for almost 30 years. For the purposes of this meeting, probably the way that we would interact most with folks is our health insurance work. So we do help people with Medicaid, Medicare, the Affordable Care Act plans, dental and vision plans. We set up a nonprofit insurance agency. So we're the first in the nation statewide nonprofit insurance agency. So we can answer any kind of insurance question. We help people navigate, claims work if they're having problems with that. We also help people with TEFRA and with regular income-based Medicaid for families. So it's really about connecting people to the resources that they need in order to be successful. Because in my family, we have children with autism and other special healthcare needs, and one of whom is now an adult on SSI. We've made that transition from income-based Medicaid to TEFRA and then to SSI, as he is now 29. So we've personally I've been through that gamut, and so we're able to offer a lot of assistance in that area. We do help families with applications from the time we complete the application with the family through to an eligibility determination, and we can also assist them with appeals. And so that is a little different from some other organizations, in that some may help you, just to get the information together. Some may help you to submit it, but we really follow it through the entire process and work in partnership a lot with Family Connection, with Change, so depending where a family is in their identification process of what the diagnosis is, what their insurance needs are, what their healthcare needs are, then we all work together to network and make sure that a family's needs are met. Because of the pandemic, we also started helping people with unemployment insurance applications, because that system is equally as complicated as Medicaid, if not more in some ways. And then we also help people with SNAP applications, or food stamps is the other name for SNAP.
And Shelli, what do you think in your field, what's the biggest challenge that our families face?
Well, in South Carolina in particular, the systems are generally set up so that only those people who try really, really, really hard, many, many times, get access to services. And so it can be incredibly frustrating for folks. You can mean taking time off work. And we just don't agree with that. You're already in need of services. You don't need to take time off work and lose money for a service that you may be eligible for before, because your income is low already. So we meet with people in the evenings, on weekends, when it makes sense for your family. We are still doing some in-person visits if that's required by your specific situation, but there's a lot that we can also do online or through a video conference like this in order to help people even now.
So Shelli, because this happened to our family, can you walk everybody through a scenario or the process after trying to qualify for Medicaid or TEFRA and being denied the first time? What does the process afterwards look like?
Sure. So there is an appeal process. So for Medicaid, often people get denied for paperwork reasons, not because they're really not eligible, but because Medicaid may have needed another document, and they send the notices with, you were denied because of section 507.12, paragraph 3. Nobody knows what that means. And the Medicaid office actually, the county offices are not allowed to help you complete the application. So they can give you the application, but they can't help you with that. So if you need help understanding what is being required, we can certainly help with that. We can help people make copies of things. In some communities in our state, in Holly Hill, there's one place where you can make a copy, and it's 75 cents a copy. Well, if you've got medical records you're trying to send, that's cost prohibitive for the family and a burden on the family. We'll make those copies. So, we'll communicate with doctors to explain to them what it is you need. We do advise for TEFRA in particular that families include a letter that describes a day in the life of your child, and you take all the worst days your child has and you put them into that one day. And it's a very difficult emotional place to put yourself, because we all want to talk about how great our kids are doing. But in that case, what you really need to do is describe all the things that your child can't do.
I did that in the comment section of ours, yes. And I thought I was just being me and a mom,
no,
saying way too much about my child.
No, it matters because with TEFRA, there is no precedence set. So for example, I had a family, I used to be an early interventionist, had a family who had a diagnosis that was not on the list. TEFRA has certain diagnoses and then related diagnoses. If it's not on their list, they need to be convinced that this diagnosis qualifies. And certainly with kids with Down syndrome and with spina bifida, you could have a child through surgery that may be developing appropriately up to a certain point. So you no longer automatically get TEFRA the way you used to. So you may have to prove a case much more. Well, just because you proved it for your child, it doesn't help my child. It doesn't set any kind of legal precedence. Each case is evaluated individually. So even my family that had 2 children with the same diagnosis, they had to go through an administrative hearing twice.
Wow. Yes, I know that process very well of being denied one time, saying my child's not determined medically disabled, and then having to prove my case. So
right.
Well, thank you, Shelli. I'm gonna have you pop back on in a couple minutes again.
Sure.
And if you have questions for Shelli, let me know. Our next panelist is Lisa Riddle. Lisa also started her career as a mom on a mission. She is mother to 2 sons with autism, which guided her journey professionally. Both of her sons have experienced multiple medical complexities, the youngest one being diagnosed with spina bifida colta after doctors spotted a hairy patch and sacral dimple. Over the years, Lisa has acted as an advocate for her sons and a mentor to families. She's the outreach coordinator and peer parent mentor with Family Resource Center for Disabilities and Special Needs. Thank you for joining us, Lisa. I can imagine that life in the middle of a pandemic and what you have going on at home can be a little chaotic and time constraining. So welcome.
Thank you. Thank you. As a matter of fact, I hope my kids will allow me to get through this without any interruptions. Yes, my journey began with here in South Carolina with Family Resource Center in 2006 when I was introduced to the Family Resource Center. And they offer a lot of resources to families, but probably the one we're most well known for is our peer parent mentor program, which allows us to work hand in hand with families to empower them with the special education process. One of the moves outside of the paperwork of TEFRA and the initial diagnosis is trying to work with the education system to be sure that you're getting the most appropriate education for your child. And a lot of families just do not know what to ask for. So the process starts with a call to our office. We do an intake. We gather records, evaluations, paperwork from the schools, and then we meet with the families. There's about 7 peer parent mentors at our office right now. We're always in need of others. All of us have some connection to disabilities, whether it's been we have our own kids with disabilities, or we have, I think, 2 school psychologists, former school psychologists that work for us now. So we all get training through Mitchell at the University of South Carolina yearly to make sure that we are up to date on the education law. And we will meet with the parents on their time when it suits them, and we will find out what their concerns and their needs are with the school, and are to teach them to be advocates. We want to empower them to be their own child's advocate and to pass that on to the child themselves. We also have a program currently at one of the, currently after the COVID is gone, but at some of the rural high schools where we're trying to work on self-determination and self-advocacy with the kids themselves, because eventually they do have to be the ones to do the work.
So are you helping children all the way from and parents all the way from elementary school through high school?
Absolutely, absolutely.
And what about into college?
We can help with that transition process. We actually have a transition manual that will help with all of the areas transitioning from from high school to college or independent living. But we don't actually work with the families once the child has moved on.
And about what age do you think, we said that you see students after being involved in all of these IEP meetings? I actually used to be an educator, so I sat in on quite a few. At what age do you see them start to self-advocate?
Honestly, a lot depends on the parents and how much they're preparing them for the advocacy role, because some of them in high school don't even realize they have a disability. They have been sort of sheltered both by the schools and the parents, and so a lot of them aren't prepared for that self-advocacy role because they don't even know that they have a disability to begin with. More and more though, we're seeing schools start to prep them earlier. Here in South Carolina, the transition piece of the IEP starts early at 13. So we are in an IEP meeting with the families, and we're using that transition piece of the IEP to point out to them that their kids will eventually no longer be in school, and they will no longer have those supports in school. So they need to start working on independent living skills as well as educational skills and employment issues. And it's not just Johnny's going to look up what it's like to be a chef. It's got to be a little intensive and comprehensive.
And what do you say to those parents that might be listening right now? Because usually I believe you're working with kids who are already identified. What do you say to those families right now who are listening who think, oh, my kid may or may not?
I think if you have any concerns at all,
what kind of advice would you give to them?
I would say if you have any concerns at all, it's time to do an evaluation. It's time to look at that, speak with their teachers, talk with your doctors, research. I can't stress enough how important it is to research what it might look like and talk with others. That's a wonderful connection. All of that you're doing today, connecting all the different organizations. Family Connections is one we frequently connect families with, because they can do that parent-to-parent portion. Anyone that can help with Medicaid and TAFRA, we're grateful to pass families to and connect them to. Any concerns or any thoughts that there might be something wrong, trust your gut and make sure you're looking into it.
Great piece of advice.
My children didn't get diagnosed until they're, I'm sorry?
I said, great piece of advice, trust your gut. I mean, I feel like I've gone on my gut quite a bit with our daughter, and it always seems to be right.
Both of my boys weren't diagnosed until they were in their elementary school, early elementary school, but we always knew there was something more to it. It took us to convince others what it was.
Well, thank you, Lisa. Again, Lisa will be up in a few minutes. And if you have questions, please submit them for Lisa.
Thank you.
Our final panelist is Luke Sharp. Luke is a teacher at an alternative high school in South Carolina and an avid surfer. Over the years, Luke learned of 3 individuals in the surfing community who all fell victim to serious spinal injuries. With each of them wanting to get back in the water, Luke knew he needed to do something. He sprang into action and created the Adaptive Surf Project. 100% volunteer-based, ASP has gone on to expand internationally and add more sports to their lineup. We're lucky to have Luke with us today. His hometown of Cherry Grove, South Carolina, was hit pretty hard and devastated by the recent hurricane. His community was without power through the entire week. We even tried to Zoom with Luke this week, and we kept losing him because he was having to run to his car to charge his phone. So welcome, Luke. Thank you for being here. We're glad that you are doing better.
Jenna, thanks for having me. Can everyone hear me? Is this thing on?
You're good.
All right. So I just want to give you a quick background. I'm the director of the Adaptive Surf Project, and we partner with another organization that we also started called Coastal Adaptive Sports, where we do our wheelchair basketball and our adaptive cycling and all the other adaptive sports. And then we work with Grand Strand Surf Rider Foundation, where we work on beach accessibility. We're working on making our beach here the most accessible on the East Coast. Then you mentioned about the international part. We work with a group called Fundamaco in Costa Rica and another one called Amigos del Mar in Colombia. And it's been pretty, and that really is like, what I want to focus on today is talk about a little bit about what we do and why I'd like to see it expand. We started, like with surfing, and it has expanded. And the deal is now, I want to share my screen with you so I can kind of show you a little bit of what we're doing. So I click share screen. Let's see what it does.
You got this.
Hope this works. It says, I don't know. I have a video I want to show you. What do I got to do here? Desktop. No, it's not really.
When you hit share video, click on, it'll pop up with the screen, and then choose what you like.
Desktop.
You can go ahead and share your desktop, Luke, and then play the video from there.
So I'm trying to do here, share computer.
And also make sure if there's audio.
Open system preferences, it says. Well, I may have to just talk. Oh, here's something. I don't want to take up too much space, but I like you to see it because it's hard to describe.
Well, while you're trying to find that video, Luke, let's talk about this. You already had mentioned about how you're trying to make the East Coast have the most accessible beaches. How are you doing that? What are you doing?
Okay, so like I said, we have a lot of we have a lot of fundraising events and things like that we do, and to like raise funds and stuff like that. And we donated money to our city to buy access mats for the beach, because people, like, how it is with wheelchair, they get stuck in the sand and things like that. So we were able to get Northwell Beach to make, I think it's nine beaches accessible. They have 140 beach access points. My goal is to get them all accessible to and many of them to high tide line, which we got to work with DHEC to do that. And that's been something that's not controversial. So it's happening. But anyway, I don't think I'm going to be able to share my screen. Must be like a setting or something in my computer, but we'll just talk about it. I want to tell you about this is a first. I'd never ask an individual what their disability is, and sometimes the line between a volunteer and a person that's has a disability kind of blurs. Like we have a person that's happens to be blind, for example, that we taught how to surf. His name is Brian. He's gotten really good. I mean, he like fires down the line, and so when we have surfing events, he also volunteers and teaches other people who have to be blind how to surf, and then helps people that have other disabilities by like pushing them into waves and things like that. Same with bike riding. We have a hand cycle. So one of the dudes that's really strong, he rides his hand cycle, but he attaches another bike on the back of his hand cycle and pulls somebody. So that's what I'm saying. Like what's happened to us is our organization has turned more into like a lifestyle than an organization. sometimes it's like for example, Sunday we're just hanging out at the beach, and one of our buddies showed up in his wheelchair and said, "Hey, let's go surfing." So we just took him surfing. And then there's a lot of people that volunteer. They're just doing it on their own. So what we do is I'll talk about the surfing side of this. We take individuals who happen to have a disability, and we build surfboards adapted for those individuals. I'm going to tell you about one of these guys named Terrell. He was adopted as a baby by his moms in New York. They moved down here. He is an adult now that weighs 500 pounds, and we take him surfing. We built this big board. We put a person on the back, and we get into waves, and even big waves. We took him out to California, and and we carried him. I got a hernia, but it worked. Me and another guy, we hold him like that. But he had a really great experience. He's just part of the group. He, in high school, he didn't have a lot of friends and stuff, but now he has this group of people he hangs out with. He's an adult now, it's meant a lot for him and his life and his quality of life. So my goal is to see this kind of expand. Like people, when we have a surfing event, which we can't have now, obviously, with everything going on, we're just taking people one at a time surfing. But we've had events where we take like 50 or 60 people surfing, and we need a bunch of volunteers, and we have different groups and stuff taking individual surfing. And then people will drive from Atlanta, which is 6 hours, to surf for 30 minutes, right? And when we have our bike rides, people will drive from Augusta and Atlanta and Charlotte. I'm in the East Coast of South Carolina. That's a long drive for a 1 hour bike ride. What I'd like to see is all these communities start to do the same thing. And that's what's great about having you all on here. We can kind of spread this. Like I said, when we went down to South America and helped them start the organization, it happened like that. It wasn't controversial. They're like, oh, we can do that. Yeah. And they started doing it. Same thing in North Carolina. We started a group there. So that's my goal, just to see this expand and because it's so, it opens up your world, right? Because I don't have any kids that have a disability or anything. I just had a buddy that broke his back surfing, and that's how this got started. So now it's like the people we hang out with, some are in wheelchairs, some are and have different disabilities or whatever, but no one really cares and no one notices.
Right.
And sometimes I get, I know the press has been really good for us, but we took a guy paddleboarding last week. Every week we've been taking people paddleboarding and surfing and stuff like that. The news shows up, interviews everyone, and it said, "Oh, what happened to you?" and stuff. And that's great for our organization. But I would like it to be just so normal that just a bunch of dudes taking someone surfing with a disability is not a big deal. It doesn't need to be on the news. It just happens all the time.
Luke, you and Ashley are going to have to touch base with Bridge to Sports, because she and I had that exact same conversation, right? We're trying to create an all-inclusive world, but it's not identified when someone needs some type of adaptation that it's being different. We're all in it together. It's all-inclusive. Yeah. So I'm going to stop you, and I'm going to have all of the other panelists jump on. And we're going to we have about 5 minutes, and get a little roundtable discussion. You guys can all turn on your microphones, please. Thomasina, I had a question actually come in for you. It's a little personal, so you can address it as you would like. The person, Marie, is asking that she heard you say that you, or maybe me when I did your bio, that you specialize in substance abuse. She wanted to know if that you have a personal connection or history with substance abuse, and how prevalent is substance abuse in, maybe, I don't know if you know exact stats about the spina bifida community, but she's also asking maybe the disabled community as a whole.
Jen, I didn't hear a portion of your question. The connection was a little fuzzy. The latter part of it. I heard the beginning, but the latter part.
They're just looking to see if you know about how prevalent, maybe not specifically in the spina bifida community, but in the disabled community, how prevalent substance abuse is.
So the first part of the question, thank you for your question. So the first part is, I don't have a personal connection with substance abuse, whereas I can personally identify with it, but I do have a lot of family history with it. So I can identify in that aspect. when it comes down to vocational rehabilitation and the consumers and substance abuse or substance use, we have a large percentage of consumers who actually may have challenges with substances, and so helping them to understand the clinical aspect of substance use is important, as well as to help their families understand it as well, because it's easier to say just stop, just quit, why don't you not do this? But if you don't actually understand the clinical aspect of it and how it actually changes the chemical processing in the brain, then it's kind of difficult to kind of help other people understand that. So I hope I kind of answered the question.
Thank you, Thomasina.
You're welcome.
I actually have a question for all of you, and I hope that in some way, shape, or form we can do this in a format where not everybody speaks it at one time. But what are common misconceptions that you feel that people have about people with spina bifida, and how do you communicate to combat that effectively? Thank you, Ashley.
I'll go. Having lived with spina bifida, I think you're always underestimated to what you're able to do. I have been at many meetings. I've had staff, and they've addressed staff before they address me, and they'll go, "Oh no, she's the founder. She did all this." So I do think, unfortunately, with disability, and I would probably say even beyond spina bifida, any type of disability, there is an unfortunate judgment that you're just not as capable. And on my team, half my team have disability.
It started sharing my
oops, hold on, Luke. And we had to rework. One of the good things with COVID, we kind of went through and cleaned things out. And when we finished, I said, "Do you realize we had 2 amputees, 1 full leg, 1 below the knee, 2 people in wheelchairs, and 1 able-bodied person?" And we did this work. And my one staff, she said, "I didn't even think about that," because she just sees the abilities and how we learn to work together. And we accomplished quite a bit. So I would think that would be my first thing, is we are underestimated for what we're very capable of doing.
I would have to agree. Yes, Miss Tracie.
I think one of the things we're trying to do at Family Connection, as far as like education related, is like we're trying to have kids with disabilities included as early as possible in the general education setting, so that more people are exposed to the fact that people with disabilities, you know, have all sorts of different abilities and look differently and all sorts of things like that, which is something we've never really had before in the past. I think people, you know, have a level of fear because they're not familiar with disability. So just trying to have kids included as much as possible and as early as possible with their non-disabled peers, and, you know, trying to make that become the norm.
Thank you. I just want to let all of you know, I'm getting some praise over here in the chat box, where all of you are so great, because this particular person lives in a place where there's little to very, very little support for disability in general. So much can be done, she says, where she lives. So she is thanking you. Also, Marie is saying thank you, Thomasina. She appreciates your answer. I have one final question, and then we're gonna have to sign off so that we can manage time well. Just so everybody knows though, all of the panelists will have their information that loops at lunchtime when you take a break. There'll be slides with all of their information that'll loop through lunch, so that if you want to write down their information, you had a question that you needed answered that maybe we weren't able to address, or we ran out of time, please feel free to contact them directly. So my final question for each of you is, what piece of advice would you supply to families? One piece of advice that you would like to supply to families when it comes to you being a resource to them?
Shall I start? go through our list here. Don't be afraid to reach out because we are genuinely here to help.
Thank you.
Yeah, I was just going to say, you know, we don't need to be praised all the time. You know, I hear people say, "Oh, you're so great, this is a good job," but really, I mean, like, you know, you people that have children that have disabilities and are taking care of adults that happen to have a disability, your job's way more than somebody that just like volunteers and helps out, because you're given 24 hours a day. So I would just recommend, you know, you don't have to like say, "Oh, thank you, you're so great all the time," because, you know, I don't think we are.
Thanks, Luke.
I guess, and just to kind of piggyback off of Luke with that, you know, just to know that there are people who are genuinely concerned and really enjoy helping people from the heart, and it's more than just a paycheck. So to reach out, as Ashley said, you know, utilize the resources that are available to you within your communities, because people really do care.
Great.
I would just like to say that I'd like to see more parents using their IEP and 504 process to help their children understand the accommodations their kids need, so the kids can start owning it for themselves and that they can carry it forward when it is time for them to advocate for their needs. And I think that process can start early and can prevent kids from feeling like they're wrong or there's something wrong with them, and instead just see it as a different way of being. We've stressed with our kids that it's just a wiring difference, that it's not that there's anything wrong with them, that they have these needs. So I think it's a great tool for families to use, the IEP process, the 504s, anything that lists the accommodations, because it should also stress their strengths and their needs.
Thank you, Lisa. Anyone else?
Yeah, I think.
Ms. Shelli.
Sure. I mean, I think when you asked that question, Jenna, about what age do you start teaching self-advocacy, it's as young as possible. You know, it begins with body autonomy of, you know, it's not okay for anybody to touch your body except, you know, your parents, your doctors, when they're doing medical things and your parents can be there. It's okay to say no. I think that's one of the biggest things. We teach kids a lot to say yes. We rarely teach them how to say no, or I'm tired, or I don't want to, or I don't like this, because we want them to be compliant in therapy and in all the other places. But it's okay to say no. And we need to be teaching them how to say, I've had enough, especially if you've got kids who are also nonverbal. We rarely teach those kids how to say no. And they need to be able to know when it's okay to say, had enough, done.
I love that, Shelli. Coming from my educational background, I see where parents don't take that step in the beginning and what it can turn into by middle school.
Mm-hmm.
And Mary, thank you.
Yes. No, I just wanted or my advice would be to always ask, or not be afraid to ask questions. That we're here to help the patients all the way through till they get approved for either disability or Medicaid. And like Shelli said, we also do the appeal process with both Medicaid and disability. And if it needs to get to the hearing level, we help the patient find an attorney of their like. And I have done many of my own hearings, because when I get very involved with my patients and I do it myself, I tell them, don't worry about getting an attorney, I'll do it. I know I'm not supposed to, but I have done it before. So the parents or the patient get the full check. I don't get anything. They all get the money. Nobody gets, the attorney doesn't get anything, which is cool too. But yeah.
Well, thank you. Well, I hope that everybody took away from that last piece of advice that is listening right now, that we are all here for you. That's a common thread and a theme right now. So again, you can find everybody's information as it loops through at lunch. I thank you all for joining us today. You're tremendous people doing very good things in the community. And from a parent of a child with spina bifida, I greatly thank you. Bye, everybody.
Bye.